I've always been interested in telling stories that highlight issues that affect the vulnerable community. So when I went deep, there was one story that stayed with me. This was a young boy who was living with HIV, and he was dying before the safe spaces actually were brought on board. He was deep down in the community. He was fearing to come and actually get this help because he feared judgment and stigma. But when he joined this safe space, he started getting like the ARVs, and his viral load elevated, and he became one of the peer educators, and he started bringing other positive children from the community to come and access these services from the safe space, because it was really a safe one for them, and no one was able to judge them, or they were not facing any stigma. So this was one of the stories that stood out with me, because he became one of the champions in the community.
This is the Journal Conversations podcast by Nigeria Health Watch, where we try to understand basically the stories behind the story, right? How our colleagues reporting around different issues, different health and different development issues across the continent. And the whole idea is to learn, right? For us, it's an opportunity to learn because, you can read the reports, what's coming out from these other countries, but also I believe it's important to also engage with the journalists who are on the ground, who understand the local realities, who are engaging with communities and reporting these stories, right? At the end of the day, we believe that, what we need to make our continent work is not just in a place, right? There are things we can learn from Nigeria, from Kenya, from Uganda, Rwanda, Cameroon, just name it, right? The whole idea is to be deliberate about learning. And of course, there are so many ways we can do this, but we also believe that with the journalists who are on the ground, that is one useful way to get insights. So that's Journal Conversation, and I am Chibuike Alagboso, and I'm glad to be hosting today's edition. So welcome to this episode of the Journal Conversation, Christine.
Thank you for having me here. And my name is Christina War. I'm an award-winning multimedia journalist. I serve as the national correspondent and the director of innovation and digital growth at the Northern Daily News Uganda. And at the same time, I serve as the project communications and advocacy officer at the Makerere University School of Public Health. And my work focuses on strategic health communication, advocacy, and using evidence-based storytelling to promote better health outcomes. And I'm also particularly passionate about adolescent health and these issues to do with the youth. Mostly, that is where my beat is always. I always report around health, around adolescent issues, around youth issues, and I'm really pleased to join this very vital and timely conversation. Thank you.
Thank you so much, Christine. That's really interesting and brilliant work that you're doing. I'm just curious, how long have you been doing it, and how did you get there, and combining all of those roles?
Okay, how I actually do it, I've been doing this for close to 5 years. Ever since I graduated from the university, I just transitioned into this because I had much experience from school. So I really find it easy to juggle through, because my role at Makerere University mainly has to do with it's an online role. So it doesn't hinder me so much in doing my journalistic work where I am, because our office is based in Kampala. So I don't have to travel to go there because the project I handle, it's a malaria project that spans around 9 African countries. Nigeria actually is one of them, our considered countries. So like it's not really hard for me because the advocacy part and communication is mostly online. I handle the most of the task online since I have to deal with a variety of stakeholders across board. But when it comes to the journalistic work, I'm on the ground. I think that is how I am able to really juggle this through, and it's not of any inconvenience to me, and I've really been able to handle this quite well.
Wow, that's really interesting. How you're able to put all of this together and do it very well. I'm really glad to have you joining us from Uganda today for this edition of the Journal Conversation podcast. As I explained earlier, it's an opportunity or a platform we created at Nigeria Health Watch as part of our, again, advocacy and communication work to deliberately ask the question, what is working, right, across the continent? What can we learn from others? What are they doing? And of course, there are so many ways to do this, but coming from that media communications background, we figured it would be useful to, have these conversations with journalists who are on the ground, who are reporting these issues, because that way we are not just going to learn from the stories, which of course you can get from reading the stories being published, but by doing this, we're able to hear and learn from stories behind the story, right? What's inspiring it? What are the lessons? And other ongoing conversations too that maybe not even were not captured in the story. So really excited to have you today as we talk about young people, and interesting that also aligns with the work that you do, things that you're passionate about. But specifically, I'm sure you've done a couple of stories, but we picked out this one because it's an area that is also of interest to us, young people, issues around their health, their sexual and reproductive health, but importantly, how, you know, funding is affecting safe spaces, because it's always a conversation around there's always a conversation around how can young people access care without judgment, care that is inclusive, that speaks to their needs, and all of this requires funding. So just curious, what are you sensing? What is the feel like in Uganda, or maybe the community or part of Uganda where you are based currently?
Okay. Thank you so much for that, and I really appreciate your effort in also trying to bring us on board to share this experience. Um, Actually, when we talk about these safe spaces, I think we all understand that these are dedicated spaces or environments where youth can access health services that are really confidential, that are respectful, and that are free from judgment. That are free from judgment, and what this means, what this funding gap really means, is that many young people really risk losing this access to services, these services that they depend on for their health and well-being. And for many adolescents, youth-friendly spaces are where they really used to receive confidential counseling, HIV testing, family planning, and a lot of those confidential help were like, because in before these spaces came, they used to shy away and they used to stay back in the community, because first of all, you're a young girl, you're going to say like, I need a condom, or I need a pill. And like maybe you meet your mother, you meet your godmother, they're like, they fear judgment, and most of them used to stay back in the community. And this really spurred a lot of, let me say, issues to do with adolescent pregnancy, teenage pregnancy. But when the youth friendly corners came, this really decreased, because the reason why I picked Otuke district, it's one of the districts with the highest number of teenage pregnancies, and a lot of those issues, it's remote, quite remote. So when funding like this really decreases, these services often become really less available. And I saw when I went to the ground, most of these health centers were really reintegrating back. They were doing what they call integration of services. Integration means this youth were supposed to go back to the initial culture of going to access services together with other, like the mothers, their elders, and it would still take them back to the stigma.
Interesting. I mean, glad that you went from the background, sort of giving a layout of what it looks like in the community where you did this story, to exploring the other bigger pictures, like how funding, the current funding cuts that that's been experienced in the development space is affecting all of that. But yeah, just taking it back a bit, because when we do this, we try to also focus on a story that the journalist that we are having the conversation with has done around the issue, and we are focusing on the one you did for your platform, the Youth and Adolescent Corners, and how they transform lives in Otuke, but also exploring how do not exit is sparking fears for the future in terms of sustainability. And it's sort of how you set it up, right? The youth and all the adolescents, all the adolescent friendly corners, operating across 15 facilities. And, again, like you mentioned, how the different services that they offer: HIV testing, STI testing, that's sexual transmitted infections. So, counseling, family planning, antenatal care for young mothers in such setting that is designed to make them feel safe, right? And of course, they put in a lot of things: games, peer educators who don't dress, very formal, so that they are also approachable, right? But then all of these things are now threatened by and mostly, all of course, we all know most of these are funded through grants, and a lot coming from USAID. And so I think you mentioned the specific program in that your report, the Joint Clinical Research Center. But again, after the whole funding freeze that happened in Q1 of 2025, and how all of those stipends that the peer educators get, the whole issues it cost. So that's sort of the setting that you put through, and how it's now, because sometimes we focus on the numbers, but I think you went deeper into the human faces behind all of those. So young people's stories, and how it anchors, you know, the impact of all of these funding withdrawals. So I'm just curious to know, of all the people that you spoke to in the Otuke community, is there any of the stories that really stayed with you?
Uh, yeah, sure. When actually I went really beyond the reporting, because first of all, what really motivated me, I've always been interested in telling stories that highlight issues that affect the vulnerable community. So when I went deep, there was one story that stayed with me. Um, when I approached the counselor of a joint clinical research center, she was able to actually link me up to one of my sources. I don't want to mention the name, but this was a young boy who was living with HIV, and he was dying because of the stigma, because of the fear to go and actually get these ARVs from the facility before the safe spaces actually were brought on board. He was deep down in the community. He was fearing to come and actually get this help because he feared judgment and stigma. What will my elders say? But remember, this was a boy who was actually just born with this condition. It was just actually handicapped in this. It was not his making. He was born with it. So like when I went to have a conversation with it, when these safe spaces came, he was able actually to go to the art clinic. Art clinic is where they always get this HIV counseling, where they actually get to bring them on board. It is okay, you can take your medication, you can come back on such and such a day, because actually he was dying. So when they picked him and brought him back, he joined this safe space. He became very active. His viral load was so low, but when he joined this safe space, he started getting each, like the ARVs, and his viral load elevated, and he became one of the peer educators, and he started bringing other positive children from the community to come and access these services from the safe space, because it was really a safe one for them, and no one was able to judge them, or they were not facing any stigma. So this was one of the stories that stood out with me, because he became one of the champions in the community by bringing other children who were actually going through whatever he was going through before this space was up, to come and access these services through the safe space. So I don't know where this actually leaves these children now that the funding gap is actually shrinking back to the initial space that they had. Yeah, I think that was the story that stood out for me when I was doing this.
Oh, wow, that's quite profound. From being a beneficiary to now being able to become a peer educator and pull others together, to benefit from the youth friendly centers as well. So, but I'm also curious, what do you think from your learning, while doing that report, and also from working in that space and seeing other youth friendly centers? I know, of course, you can't report on all of them, so you picked on that particular one. But what do you think makes them work, right? The services they get, or something about the environment, how those spaces are created. What are your thoughts?
Okay, I think what makes it actually work, because first of all, there is an enabling environment. Even you, let me say, if you are to go to some space, let me say if you go to let me say also a country or something, the way they welcome you, the first impression. So when actually I reached the health center, they have very many activities that keep this youth, um that keep them actually coming, that keep them wanting. First of all, is because of the experience, peer educators, health educators that are on ground. They are actually youth like them. They didn't put, let me say, elders, or let me say people who are not youth. The health educators are actually youth like them. And also, there are very many healthy corners at the facility where they actually go, they interact, they play games, they have ludos, they have actually a football pitch where actually they go and play and they interact together. I think what makes it work is the fact that there is an enabling environment. There is also a welcoming environment at the health center, where they have that specific room where they go and sit, they play games, they interact, they share stories. They also have fireplaces where they come, let me say, in the evenings, and they tell these stories, and they get to interact, and they get to get familiar with their peer educators, with their fellow youth, at the center. So I think this is what actually makes it really work there, because the environment alone is welcoming, and there are small curriculum activities that they do that attracts them more actually there, because they even have clubs at the center.
Mm, interesting. I mean, going back to the your response earlier about the story you said was one of those that stuck with you. I was actually going to ask this follow up. So, who do you think is more? And this is just when I say fun question. Who do you think is more influential, right? Or plays a bigger role? Is it the peer educators or the clinical staff? I believe, of course, the clinicals, they have to receive the care. But I'm just curious who you think, young people are connect with more. Is it the peer educators or the clinical staff who actually deliver the care?
Actually, there's a delicate balance when it comes to that, because the health educator uh, is actually one of the people who they interact with most. So how they get it, they actually make sure that they get a person who is very friendly to them, who actually goes more to the community, because they do community outreaches. So they get a person who can easily interact with the community, like getting to meet them halfway, a youth like them. someone who understands their situation. So like they are more familiar with the health educator, because actually even me just interacting with him, I felt very interested about the entire stuff, because like he was very friendly. He makes you understand, like there's a way he doesn't stigmatize. He brings you to board and makes you understand these issues quite well. So I think the fact that he's very knowledgeable in whatever things that he does, it makes it easy, because first of all, the health educator who has been employed there was also one of the beneficiaries of the friendly corners. So when he got employed there, they just made him to actually continue with this role. So it gives him that rapport with this youth, actually much better when it compares to, let me say, their peer educators.
Awesome, thanks. How are these youth-friendly spaces? How are they deployed? Is it in communities, in schools, or clinics, or a mix of all of this?
Actually, there is it's actually at the health center. It's at the health center, but they do community outreaches also. But it is actually, it's actually a building at the health center that is dedicated to the youth. They just get one building where actually it's only the counselor and the health educator that can access and give them the services, ARVs, family planning services. So it's actually at the health center mostly. It's based at the health center, because this is where the counselor for JCRC, that is Joint Clinical Research Center, is also based. Yeah.
Interesting. So now that, speaking of the funding now, because of course all of this requires funding. Someone has to pay for it. Even if those young people are accessing the care for free, someone is paying for it. And in this case, mostly through grants, that we mentioned earlier. So what are local communities doing? How are they able to sustain this now that there's all of these funding cuts, or everything is now on standstill? I know, the title of your story is around these spaces are important, but then with the funding cut, there is fear that they will be discontinued. What is the pulse? What are you sensing around, are there efforts to take it up and take ownership and invest by the government and local communities?
Okay. Actually, when I had a conversation with most of the community leaders, their fear is that, first of all, these corners have been helping their children to, because first of all, this is a remote community that most of the parents don't have the time. They don't have the time to put their children down and tell them, get, you are now an adolescent, you have to do this, do that, you have to understand this, you need to understand that your body transitions from this and that. Like, they don't have that time. So these corners were actually helping a lot. So what the fear is that with the funding gap, with the funding actually phrase, they feel this actually these corners will actually vanish. And once these corners have vanished, they will go back to the drawing board. They will get back to zero, because they don't have any plans. They don't, because first of all, us funding was really doing a lot in these corners, because they were funding everything, paying like for these corners, sending, let me say, those family planning services and paying the counselors. So the community do not really have the capacity to actually continue from here. What they're doing is they're actually appealing to the government. They're appealing to the government to actually come and fill this gap. But looking at the conversations that are actually going around, looks like government still does not anyway have any plans to pick up these corners, because initially government was trying to doubt, will these corners actually work? Will they work out? How will they be able to actually curb down some of this, let me say, rate of HIV and a lot of other issues that come with this. So when government was doubting, some of these donors came in to fill that gap for the government. They came in and they were like, look, this is how we do it and this is how it's going to work. You don't have to doubt it. And like they were really doing it well. So it takes us back to the drawing board. I don't know if the government is going to pick this up, since initially they were really doubting it, that will it really work, how does it actually work out. But when these donors came in, they were trying to show the government that, look, this is how these things work. If you invest in this, this is how it's going to work. But now the community is calling upon government to come in and take over, but they have not yet actually given their stand about how they plan to really come in and continue with it. Because first of all, the councillors have left. The one I phoned was actually having a week to go. They are actually leaving the facility and they have that fear that they cannot continue because who is going to pay their salary? Yeah, so everything is just in a dilemma, and yeah.
Oh, I mean, speaking of government call and the call for government to take more ownership, I understand Uganda. I can't remember when this happened, but Uganda's prime minister talked about mobilizing additional funds for HIV programming. So, is any of that happening yet? Are you hearing anything about actual releases, not just the call for or announcing that there will be more funds released. Is that happening? And because again, if we know if it's happening, then we can even talk about whether some of those will reach young people or services specific to young people.
Okay. First of all, there has been a reshuffle recently, and the health minister has been reshuffled, and this is a new financial year. Everything is just trying to, okay, government is also having a lot when it comes to issues to do with health. Sometimes yes, it is easier said than done, but when it comes to implementation, it will not reach the last mile. Because first of all, when I talk of the last mile, like that community deep, deep, deep in the, like you said, the local government, by the time it reaches there, when will it actually reach? Will they also, they might just, let me say, focus on HIV, yes, but when it comes to youth friendly corners, it has a lot of things to do with, let me say, family planning, when let me say, mental health issues. But this is where our government is just looking at, let me say, the rate of HIV. But what about other aspects? Because actually there's still nothing happening on the ground anyway. There's still no plan. Everything is still on paper. When you go to the ground, actually it's just getting to, the only thing that the health center in charges are doing is the integration of services. They have to integrate the services back to let everyone get services at one serving point. Nothing like a friendly corner, nothing like a special corner, because they're trying to like look at how can we actually minimize this and make sure that the little health budget that we have covers this. Not, they don't have a program, I mean like a plan for the youth friendly corners. Some of these things, they, okay, I'm sorry to say that they are easier said, but when it comes to implementation, you cannot easily see it. It's still the way it is at the health centers, because I keep interacting with them. Actually, most of them have left. The counselors have left.
Interesting. So, I mean, as we wrap up, this has been quite illuminating conversation. And like she recalled, the whole idea of this is to learn, hear what colleagues are seeing and how they are reporting, and a bit of the story behind the story that they are reporting. So, if journalists, other journalists in the continent who are covering or reporting on different donor-funded health interventions, what do you think they should be looking out for, especially if they're trying to keep an eye on the impact of the funding cuts? What should they be looking out for in terms of programs that are quietly disappearing, like you saw in your reports?
Okay. I think actually looking at the budget, the budget that has been read recently, you find that government of Uganda allocated 5.23 trillion to the health sector. But when you look at the last financial year, 2025-2026, it was 5.87 trillion. So that is already a reduction. But let me say when I'm okay, let me say the issues that journalists can actually focus more on trying to push for this. What how is okay with the funding gap? What is the government planning to do? What's next now? What is next? What is government trying to do? Are they trying to take over these corners? What are some of the initiatives or strategies that they're trying to lay down to pick up from this, apart from just consolidating or getting back to what they say, how integrating all the services together? What's beyond the integration? What plans do they have for the youth? Do they plan to continue with this youth friendly? I think these are some of the questions that journalists ought actually to ask the government. What is next? How do they plan to come in and step in the gaps that the donors have left? Yeah, I think that is some of one of the areas that journalists can interest themselves in.
Right. Thank you for that. And on the other side, so if a policymaker is listening to this, right, what is one thing that you hope they can take away? A policymaker or even a regular listener, what is one thing they can take away from the reporting that you did, the experiences that you saw on the ground, and how things are changing since the past 1 year or so.
Okay. One thing that a policymaker can take away from this is that funding may change, but the health needs of our young people do not. We must really see a way of building a sustainable system that ensures that every adolescent continues to access this care, this information, and the support that they need. Behind every budget is a young person's life. So, protecting these youth friendly corners or services means really protecting their health, protecting their education, and also hope for the next generation. To any other regular listener, if there is one thing that I would like to take away from this, is that investing in the youth or in these use spaces is not an expense. It's really just an investment in the country. So every young person deserves this access to the confidential, respectful, and quality healthcare, regardless of the change in the donor funding. We don't need to look at just like the donors have gone, so we are vulnerable. No, we need to pick up from here and see that we continue to invest in these youth friendly corners by offering supports in one way or the other. Yeah, I think that's what I have to say. It's my takeaway from this.
Wow, thank you so much, Christine. That is quite profound. I think one thing you said that that really hits me, the fact that even though funding change will change, the health needs those will never change. They will still be there, and those budgets, they are not just figures. They impact real lives on the ground. Thank you so much for those strong calls. I'm hoping as we put this out, those will be strong messages that listeners and people will take away. Not just listeners in Nigeria, but from Uganda, different parts of the continent. Like I said, the whole idea for this is cross learning. How do we learn from each other? How do we give insights to each other to continue addressing our problems, our needs as a country, as a people, as a continent. Really appreciate your time and sharing your thoughts on the work you're doing, the story you wrote about on this episode of Journal Conversations podcast by Nigeria Health Watch. Really appreciate.
Thank you so much. I also appreciate your initiatives. I appreciate the strategies you've come up with to give us the platform to share these experiences, to go beyond the headlines, go beyond statistics, and get to really share our experiences and get a solution on what works, what does not work, and the way forward. Thank you so much, and I really appreciate your time. I appreciate you giving me this platform. Yeah, I've learned, I've relearned, I've unlearned a lot from this. Thank you.
Thank you so much, Christine. Thank you. Really appreciate your time too and your kind words. This has been made possible by Nigeria Health Watch Journal Conversations podcast series. You can get us anywhere you get your podcast, and please do reach out if you have any thoughts, any contribution, any solution really that you want us to talk about, or something that is working around you, or even not working, because we believe if people don't know about the issues too, we talk about them. We don't shy away from talking about them. But the conversation now becomes, if the problems are out there, we now start asking what's working. Do we know enough of what's working so others can learn? So you can reach out to us through any of our social media platforms, just Nigeria Health Watch, and we will show up, or podcast at nigeriahealthwatch.com. It's been a pleasure hosting this episode. My name remains Chibuike Alagboso. Thank you, and over.